Good morning to my colleagues in New York. Good afternoon, good evening to all of you joining us. I'm Safwan Masri, Executive Vice President for Global Centers and Global Development at Columbia. And it's really a pleasure to welcome you to this session and this webinar on vaccinations and getting ready to return to campus. We really miss having students on campus. We miss, of course, all of us having normal campus life, and we are working very hard to try to make sure that your transition back to campus is as smooth as possible. And I'm delighted that we have dedicated professionals at the university who have really been shepherding us throughout this COVID year and who are helping us ensure that we get everything in order for you to be able to come back to campus. I'm going to turn it over to my colleague, Julie Kornfeld, who is Vice Provost and also a member of the faculty at the Mailman School of Public Health, who will introduce and share this session and introduce to us also the three individuals to whom we owe so much this past year and going forward for really shepherding our health situation on campus, Wafaa, El-Sadr, Donna, Lynne, and Melanie, Bernitz. But I will turn it over to Julie now, and she will introduce them more fully. Julie, over to you.
Thank you so much, Safwan. Pleasure to be here this morning. I'm going to have us jump into the panel so that we can provide you with an update on what is happening with respect to vaccines globally, as well as here in New York and on campus, and importantly, our updated plans for health and safety as we plan, as Safwan mentioned, very enthusiastically for a safe return to campus. Here in New York, the news is very good. And we are making plans very busily for a safe return to campus with many academic and student-related activities to be in person. So let me quickly introduce our panel. Dr. El-Sadr, the University Professor of Epidemiology and Medicine and Director of ICAP at Columbia University. Donna, Lynne, Senior Vice President and Chief Operating Officer of CUIMC. And our University COVID Director, and Melanie Bernitz, our Associate Vice President and Medical Director for Columbia Health. We will each speak for a few minutes, and then we will turn on things over for questions and answers. Please post questions for us in the question and answer opportunity, and we will answer them as best we can. We likely will run out of time for some questions, but hopefully we'll get to as many as we possibly can. Wafaa, I'm going to turn things over to you.
Okay, thank you very much, Julie, and thank you, Safwan. And I'm going to share screen. Okay, hopefully you can see my screen. Great. Okay, so let me give you a quick update on the status of the global pandemic. As many of you are well aware, because many of you are situated in various parts of the world, you can see that now we've had to date more than 175 million confirmed cases, more than 3.7 million reported deaths. And the good news is that have been more than 2.34 billion doses of vaccine that have been administered. Of course, I always say you need to divide this by 2 to get at the number of people who have been vaccinated, because most vaccines require 2 doses. And on this side here, you see in this map that the top 5 countries in terms of largest numbers of cases reported to date are the US, followed by India, Brazil, France, and Turkey. Now, importantly, what's happening in the world now in terms of the recent hotspots, and here in the darkest brown, red, are countries where looking at that had the highest average daily numbers of cases per 100,000 population in this past week. And this tells you that we continue to see major hotspots and transmission in South America, as you can see in this map, particularly has been noted in Argentina, Uruguay, Colombia. There's also a third wave that's happening now in Southern Africa. And you can see other countries around the world, including Mongolia here, and with increasing numbers of cases, as well as Indonesia and Malaysia, and also other countries in the Middle East, where there's been a recent reported increase in numbers of cases. In the United States, the news is good. As you can see here in this figure, is that we're now seeing a decrease, as you see here, in the daily numbers of confirmed cases in the United States, which is very good news. And also we can see them in the blue figure down here, similarly good news in New York City in terms of, again, a decreased the numbers of cases in New York City and in the country overall, down to about 200 cases per day, which is really good news, and less than 1% positivity amongst those who get tested. So let's move on to vaccines quickly. As you are probably also well aware, there are 3 vaccines that have been authorized for use by the Food and Drug Administration in the United States, the Pfizer-BioNTech, Moderna, and the Johnson & Johnson-Janssen vaccines. And there are 3 vaccines that have been authorized for emergency use by WHO, the AstraZeneca, Sinopharm, and Sinovac vaccine. I think just to keep in mind that they use very different approaches. These are mRNA technology, viral vectors, or inactivated viruses. So it's nice to have a mix of different kinds of vaccines, but also overall, you can see here the efficacy of these vaccines, and all of them have shown efficacy greater than 50%, although there's quite variability in terms of the reported efficacy. But I always, again, keep in mind that these studies that looked at this were done at different time points and also in different populations. The other good news is that most of the side effects have been mild to moderate and mostly at the site of injection, with few other systemic kinds of side effects that have been reported, but these usually dissipate within a few days. The one exception has been the clotting, the rare clotting side effect that was reported both with the Johnson & Johnson-Janssen vaccine as well as with the AstraZeneca vaccine. And that's been reported in about 7 cases among 1 million vaccinations. How are we doing globally? This is the numbers of vaccinations per 100 person. Globally, the darker the green, the more vaccination. And some countries have done quite well. You can see here US and Canada, several countries, Uruguay and Chile and South America. You can see several Western European countries, as well as also several countries in the Middle East and in China, Mongolia. And at the same time, you'll see there's some parts of the world where there's barely been there's been very limited vaccination ongoing. Now, these vaccines, overall, they work. This is just looking at the United States, what happens with the scale up of vaccines over time. This is in 2021, these months. And you can see over time in the US, we're seeing a decrease in numbers of cases and also decrease in numbers of deaths. So this tells us that these vaccines work in real life settings beyond the initial studies where I showed you the data previously. We also know that from other countries, these are data from Israel that show another country that has done well with about 50% of the population vaccinated. And you can see the effect on in terms of decreasing the numbers of cases in the country, whether they be with symptoms, without symptoms, hospitalization, severe illness, and deaths. So all good news. And these are other data that show not only vaccinations work in terms of decreasing the numbers of cases over time, but also there's evidence now that as you increase the vaccination in a population, you decrease the numbers of cases in the unvaccinated population as well. So these are also data from Israel that show that as we increase the coverage with vaccines amongst younger people who do not have access to vaccines, there's also a decrease that was noted in terms of the numbers of cases. What about the variants? These are different strains of viruses, and there are 3 types of variants: those of interest, those of concern, and those of high consequence. Their typing is going on around the world to identify these variants as quickly as possible. And these are 4 of them that are now of concern. The B.1.1.7, now called the Alpha variant, and that's the one first identified in the UK. You can see now it's broadly reported from almost every country around the world. This is the B.1.351, called the Beta variant, that was first identified in South Africa. And again, you can see the rapid expansion globally. And then you can see here a P1 variant identified first in Brazil, and again reported from several countries around the world. And then most recently, the Delta variant, which is the B1617, first reported in India. And now you can see that these variants, once they're identified and they have an advantage of being more easily transmissible, they're very rapidly are reported from other parts of the world. The important thing is that what about the impact of these variants of concern? And we worry about several things. And we worry about whether they're more easily transmitted. We worry about whether they cause more severe illness. We worry about what about the risk of reinfection in somebody who's already had an episode of COVID-19. And of course, we worry whether these new variants will in any way compromise vaccine efficacy and effectiveness. And I don't have time to go through this table, but I think overall, we can say that all of these variants of concern have increased transmissibility, and that's the reason why we see them dominate and being reported from different countries of the world. And on the other hand, there's a little bit more of mixed data in terms of whether they're associated with more severe illness, as well as also whether they compromise our vaccine efficacy. But there are some data, like for example, with the one from first identified in South Africa that appears to decrease the efficacy, at least with one of the vaccines that has been used. But on the other hand, we also have good news. These are data from Qatar that show that in this country that had done also very well in terms of vaccination. This is the Pfizer-BioNTech vaccine. And it shows here that this vaccine really worked well against the UK variant, the Alpha variant, and also worked well against the variant from South Africa, and with high efficacy, so that's really good news. So I think we have some reassuring news with some of the variants, but for other variants, we really don't have sufficient data, particularly in terms of the latest variant, the 617 that was first reported in India. Two questions we get asked is, what about booster shots? We don't know. The answer is that whether a booster shot is going to be needed or exact timing of when a booster shot is to be required, this is not known, but there is ongoing research to try to determine whether this is if this is going to be necessary and when. Most people believe that it might be around every maybe at 1 year anniversary that a booster shot may be needed. And then the other question we get asked is about mixing of vaccines, and we again don't have the data on this, but there's an ongoing study now to look at this mix and match, to look at the effectiveness of giving one vaccine from one type and then the second dose from another vaccine. And this is ongoing research, so stay tuned. So I'll stop here. Thank you, and hand it over to Donna. Thank you, Donna.
Great, let me share my screen. All right, great. Well, I'm going to continue where Wafaa left off and bring you back to New York City and to the United States to give you a flavor of what things look like here. As you saw from Wafaa, there's been a lot of success internationally on vaccines, and here in the United States in New York, that continues. But let me just do a quick little snapshot of what the campuses look like for the last 15 months and what you should expect in September. So we've had rigorous COVID testing. We have had requirements for masking indoors and out, very limited gathering sizes, and a lot of other safety requirements from sanitizing to really limited capacity. Up until recently, none of the locations on campus could be at more than 50% capacity. We're now at 100% capacity in any location. However, we still need to maintain 6-foot distancing, and as I said, wear face coverings. We expect by September, in fact, that will all be gone, and the only masking that will be, or face covering that will be required, will be for unvaccinated people who, by virtue of getting an exemption for having to comply with our vaccine mandate. So I'll go into a little more details around that, but for those of you coming back, you should expect classes in person. You should expect other events as you've had on campus in prior years, and really a full return to dining and so forth once you get to the campus. So as Safwan and Julie said, we're all looking forward to seeing you in the fall. So let me bring us down to New York. And as you heard from Wafaa, first of all, the percentage of COVID positive patients that we test every day is below 0.5%. And as you saw from Wafaa's graph, very similar to what we had last summer. And hopefully just the most effective treatment is the vaccine. As helpful as face coverings have been, we hope that this is a continued return to those kinds of numbers without the kind of spike that we saw in the post-December period. So the vaccine campaign, which started on December 15th in the United States, has been quite successful and aggressive. Over 305 million doses administered. And again, think of what Wafaa said, divide by 2, so that's 150 million, roughly 150 million, a little bit more people. And of course, that's in sequence, and we have some people who are still completing their vaccine series. We started off in the United States. There were various age requirements, but until recently, what we define as adults is now 18 and over. However, we have been giving the vaccine to 12 to 17-year-olds as well. And of course, there's conversations about perhaps later on in the year, even reducing that age requirement. So adults are defined as 18 and over. And so in terms of 2 doses of the Moderna or Pfizer or the 1 dose for J&J, more than 50% of adults have completed their vaccine series. It does vary tremendously by geography. New York happens to be a state that is above the average, and the South is generally where we have less uptake in terms of the vaccine. So again, think about the US with about 330 million people. So this is a significant achievement. And similarly in New York's administered about 19 million doses. So almost 70% of adults having completed at least 1 dose. This is as of last Thursday. Obviously progress made over the weekend, and I'll talk to you about the 70% number and why that in fact is significant. Despite all the vaccination work going on, there are going to be still some places where masking is required. Right now, you have to wear a mask in the subways, and you also have to wear a mask at Columbia indoors. But going forward, certainly healthcare facilities, including the health campuses on the 168th Street campus, will continue to require face coverings. That could change, but right now, that is not anticipated to change. So this gives you, that was the country, the state, and now this gives you a sense of what's going on in New York City. So a little less compliance if you look back at the slide. So for New York State, 69% of all adults have completed their first dose. In New York City, it's only 64, but again, still very, very significant numbers. You can see Manhattan is, and it has always tended to be, the borough with the fewest number of COVID positive cases, as well as with the highest vaccine percentage. So we issued a vaccine mandate, first for students back in April, and then in May for faculty and staff. The requirement is that you must be vaccinated for the fall term, but documentation and completion, and I'm sure Melanie will go through, there's a time frame, which basically says you really need to start getting vaccinated if you haven't already by next week, or you will miss this August 2nd deadline. We'll provide some flexibility for people who have to wait to get vaccinated because perhaps they're not eligible in their country or there's a shortage, but we'll discuss that in a minute. We are not alone at Columbia. There are nearly 500 universities that have mandated a student vaccine, and a little under half of those have also mandated it for faculty and staff. Some employers are starting to mandate it here in New York City. New York Presbyterian, who's our hospital partner, just issued their mandate last week, and we expect some other hospital systems, particularly in New York, to follow. So if you were on campus at all, but if not, there is an app that we have asked people who are present and coming into campus to download. It's on the Apple phone, it's on Androids, it's also on the web, and it's called Reopen CU. If you've been accessing global centers, you may be familiar with that. And on the Reopen CU app, we not only ask you to attest to your daily symptoms, but there is also something called the Columbia Health Compact, which is basically your commitment, as well as the commitment of faculty and staff, to keep the campus safe. So we'll go through that in a second and what that looks like. As Wafaa mentioned, the acceptance of the vaccines here is our three US FDA EAU vaccines. We also are accepting those that have been authorized by the World Health Organization, and we will revaccinate individuals who receive the non-FDA or non-WHO authorized vaccines. I noticed a couple of questions in the chat box. Please feel free to continue to update those. And then even if we will continue a testing program for COVID testing in the fall, and even if you're vaccinated, you will be asked through surveillance testing to participate in the Columbia testing program. And if you do receive an exemption, you will also have to participate in the testing program. So students, I'm going to talk about students, and I'm sure Melanie will go into a little bit more detail, but students right now, in order to register your vaccines, you don't go to your app. You go to this website to register your vaccines, and there's also a really nice video that takes you through all the steps. Once you do that registration, we upload your information into the Reopen CU app, and these are the critical pages on the Reopen CU app. I'm going to ask you not to think that you should do anything on any of these except the daily attestation, which you do, and then you hit submit. And then once, if you look on the left-hand side, you see this My Checklist. You will have a box automatically checked on the fourth item that will confirm that you have been vaccinated, and it will allow you to get a green screen. The right-hand side is for faculty and staff. You're not required to do this piece because the operations that Melanie will go through will give you information on how students actually go even deeper on the Secure Health portal to be able to upload their information. So once you've completed those four things under the checklist, your compact, your training, your testing, and then going to the Secure Health portal, all four of those items will be checked, and you will get a green pass every day you come back to campus, as long as you don't have any COVID symptoms or have been near anybody or tested positive. So the last thing I just want to cover, and then I'll turn it over to Melanie, is there has been a lot, I'm sure, going on in all the countries that you are in terms of changes, whether it's changes in lockdowns or other requirements to keep everyone safe in your countries. And just in the last week, we've had some pretty significant changes, and I can tell you that New York looks very different the past 2 weeks than it did for the last 15 months. So as I said, masking or face covering is now not that common here. We've not been on a lockdown. We have been on some degree of curfews when it comes to restaurants and bars, Those are no longer in effect. And in fact, large public venues like Madison Square Garden and the various baseball stadiums are now pretty much completely open. You do have to show evidence of a vaccination status when you go to some of those venues, or you have to have proof of a COVID test. So these are the two things that are most important. The first is that we did get confirmation, as I said, that we can reopen the campus in September based on the fact that we implemented a vaccine mandate. So the second thing that is about to happen, if you remember, the New York State number was about a little over 69%. When we get to 70%, which we expect this week, 70% of all adults having gotten their first dose, the governor intends to eliminate. All he has said is COVID restrictions. We don't know every single one that will mean, but we suspect that it will be different. And as I said, if you're here in New York, you definitely will know that it is a different environment in the last 2 weeks than it has before. So I will stop and I'm gonna turn it over to Melanie.
Thank you, Donna, and hello everyone. Let me share. Great, here we go. All right, so good morning, good afternoon, good evening. Hope you're all doing well and thank you for joining us. So Wafaa shared the global picture, Donna shared the New York City picture, and just to share our campus picture, as good as New York City is, our campus is actually even better than the New York City situation you heard described. We have done a lot of testing on campus. We've done over 260,000 tests since last June, and our overall positivity rate has been 0.35%. We also do random surveillance testing on our population, which gives us a true prevalence estimate of what's going on. And that ranges anywhere from 0%, as you can see from the last couple of weeks ago, to a high of 0.37%. So very much below the ranges we've seen in New York City. And this should give you a sense of the strong safety of our campuses. We continue to track cases that we detect outside the university as well. We have our own homegrown contact tracing team that responds very rapidly. And we know that this rapid response has prevented further transmission. I like to remind you, wherever you are, of the resources available. The COVID19.columbia.edu has all of the information you're going to hear today and much more. It's where we update FAQs. As we learn more from all of these forums, we update those FAQs. There's also a chat bot. You can ask specific questions and real-time data that we post there. So do bookmark COVID19.columbia.edu. Donna shared a lot of information about what's happening in New York City, some of the things we've heard from CDC, and I just wanted to share the process that the university goes through for adopting this guidance, so you can kind of understand how these decisions are made. We've had this process in place for over a year. It's worked really well for us, and it allows us to look at the guidelines, recommendations, requirements, and data that are coming from all these different sources and use them to inform our campus response. But the first thing that happens is the CDC, the Centers for Disease Control and Prevention in the United States, comes out with guidance. That is reviewed. We then wait for New York State to adopt that guidance, and then actually for New York City Department of Health to come out with their approval of such guidance. Then it comes down to the university, to the Presidential Advisory Task Force, and that's when we adopt the guidance. And this approach has been really successful. We'll continue to use it, and it's allowed us to keep the campus open. We've not had to have a shelter-in-place order. Our labs have stayed open, and our environment has been very safe. So I just wanted to share that. Donna showed you the daily attestation. We continue to use this. I always tell everyone this has become as familiar to those of us coming to campus every day now as brushing our teeth. We continue to adjust it. We'll continue to adjust it as going through, as we go into the fall, but we ask that you answer that honestly. You may not be able to download it till you're back in the United States. Don't worry, all the pieces that get fed from the back end will be updated. And you'll be able to use that when you come back to campus. So we always get a lot of questions about testing. And as I mentioned, we've done over 250,000 tests in the last year. Our testing approach is something we evaluate continuously. We've adjusted it as the situation evolves. We use a lot of modeling data. We consult with our university experts, and we really like the flexibility and adaptability of it because it allows us to adjust as the situation changes. We have 2 large-scale, high-throughput testing centers. One is on the Morningside campus at Lerner Hall, and the other is at CUIMC. In the Black Building. We can do up to 3,000 tests a day if we need to, though this volume has reduced significantly as the need for testing has gone down. But what's testing going to look like for the fall semester? The first thing is something called gateway or re-entry testing. There's nothing magical about this test except it's the first test that you have. And that's going to be required for anyone who has not accessed campus in 2021. If you've been on campus in the summer, you will have had this test already. But if you're new to campus, your first test done will be called your gateway test. And that will allow you to meet that testing requirement that gets that checkbox on the app that Donna showed. You can do that in advance of return to campus if you are around campus or within 14 days of your return, though that requirement may be slightly different. If you haven't been vaccinated, then the requirement will be more immediate for you. After that gateway test, we have ongoing surveillance testing, which is actually really important to monitor the ongoing campus prevalence of SARS-CoV-2 and allows us to detect if we need to adjust any of our other public health protocols. And this is where we will branch depending on your vaccination status. So those who are vaccinated will still be required to participate in ongoing testing, though at a very minimal level. And it's something called our random sampling surveillance. Every week, we randomly select a small group of people accessing campus and ask them to be tested even if they are vaccinated. If you are unvaccinated, so there's 2 groups for this. There's those who will get a medical or religious exemption that I'll talk about shortly. They will require weekly testing. We also understand there is going to be a small percentage of our international students returning to campus who haven't been able to access vaccination before their return. And until they are fully vaccinated, they will fall into that unvaccinated category and will have to undergo weekly surveillance testing. And then finally, we do wastewater surveillance in our residential halls in the undergraduate buildings. This has been a phenomenal partnership with the School of Engineering, where we've been looking at the wastewater on an ongoing basis. And if we detect SARS-CoV-2 in the wastewater, we can then pinpoint exactly where that's coming from and ask for increased testing in that building. So those are the areas of surveillance testing you can expect for the fall. As I mentioned, we are going to continue modeling this, so this may change before the fall based on the surrounding situation. So a little bit more on vaccination. As Donna mentioned, we have the vaccine mandate in place for everyone. And we know that in the US, we have adequate vaccine supply and everyone over the age of 12 is eligible to receive a vaccine. So if you're in the US or if you're arriving in the US over the summer, we encourage you to get your vaccine as soon as possible. For international students, we recommend strongly wherever you are located, if you are able to be vaccinated as soon as possible and receive a full dose series for optimal protection. We know there's wide variation in terms of vaccine availability internationally, as well as which vaccines are available. We will accept any vaccine approved by the World Health Organizations, as well as the 3 authorized in the United States. And as we previously mentioned, those who are unvaccinated or partially vaccinated at the beginning of the semester will still be allowed to return, but will have added restrictions, and more information will come out about that. And we will communicate with you in terms of the process for notifying us if you have not been able to receive vaccination, so we can make sure you understand what those restrictions are. They will include masking and distancing, as well as regular testing. So how do you complete the vaccine requirement? We hope everyone is able to upload and complete the process by August 2nd. As we mentioned, the vaccines are either accepted, or those authorized by the US FDA or the World Health Authorization. In terms of what we mean by fully vaccinated is this magic 14-day number, and you're considered fully vaccinated at least 14 days after the second dose of a 2-dose vaccine, or 14 days after a single-dose vaccine, which currently is only the Janssen J&J. And then you need to go through the process of uploading your vaccine requirements. As Donna showed you, if you go into the app, the student link is there from the app, but you don't need to have access to the app in order to do that. This is done through your student student health portal. If you're a Morningside student, it's through the Columbia Health portal. And if you're a CUIMC student, it's through the CUIMC Student Health on Haven portal. If you go to the COVID19.columbia.edu website, it will link you to both of those portals so you can upload your vaccination records. What do you need to upload to prove that you're vaccinated? Any of the following. So the CDC vaccine card, if you're vaccinated in the United States, a World Health Organization booklet, or any documentation from your physician or from the vaccine site where you received your vaccine showing that you've been vaccinated. You'll also be expected to enter the dates of your vaccine. So those are the documentation that we'll allow. So this is the timeline. It looks a little complicated, but hopefully it helps. Obviously, we're trying to get to that end point of August 2nd, that deadline date. So as Donna mentioned, if you are receiving a 2-dose vaccine series, in order to meet that deadline, pretty much by next week, you need to start many of those series. Obviously, those that have a 28-day window need to be started sooner. Pfizer only has a 3-week window, so it's a little later. And then obviously the Johnson & Johnson, a single dose, you just need that 14 days before the deadline. We do understand that for our international students, this may not be possible before you arrive. So we encourage you to try and arrive as early as possible in order to do this, and knowing we will hopefully have Johnson & Johnson available as that single dose. So if you get that upon your arrival in the United States, it is only then 14 days till you are considered fully vaccinated. Regarding the medical or religious exemptions, these must be submitted through the same student health portal, and the processing does take some time. So please submit that at least 30 days before your campus access. It can take that long to review. Obviously, if it's not adequate documentation, we need to be able to have time to get back to you to allow you to submit more documentation. So just a little bit more information. The only 2 exemptions we will consider are religious or medical exemptions. As you can do this through the student health portal. We will consider all requests, but obviously approval is not guaranteed, and we will notify you with a determination letter. In order to apply for either one of these exemptions, you do need backup documentation. So if it's religious exemption, your personal statement and documentation from a religious leader, and for a medical exemption, backup documentation for your medical condition. If you have applied for a religious or medical exemption from prior vaccinations, that is not enough for the COVID-19. Obviously, there are some differences, so you will need to reapply. And again, just to reinforce, personal and philosophical objections to the vaccine are not considered here. I always like to end with a reminder about the extensive resources for our students. Whether you're here already or coming back later, please be sure to check out both our in-person and virtual support services at Columbia Health and Student Health on Haven, regardless of your location. Lots of medical and counseling services, as well as health promotion, disability services, sexual violence response, and lots of information on insurance, on immunization. So please be sure to check out our website. And with that, I will turn it over to Julie. Thank you so much.
Thank you. I know we're going to have a lot of questions coming in, and they're being answered as we go, but I'll go through some of those common questions just so everyone has the opportunity to hear from our panel. But let me just say a few words. I think a lot of these things have already been brought up, but I want to reinforce to all that the university is planning to be in person. We are requiring all of our students to return to campus, and we're really looking forward to safely returning. And I think you can see that there's been a tremendous amount of work to ensure that this will take place. So we expect on September 9th, when we begin classes, that we will be a fully vaccinated campus. And as you heard, the CDC and New York State is updating their guidance. And we plan that this guidance will be in place and fully reviewed by then, and that we will not be required to wear masks in the classroom and distancing by September 9th. That is the plans that we're making. And that is because we expect to be a fully vaccinated campus, and we expect that New York State will update update their guidelines as we reach that magic 70% of vaccinated individuals. But please stay tuned. Obviously, if things change in the public health condition or in New York City, we will update that. But that is our plan, and that's what we are very much working towards. I want to just say one other thing I think that hasn't been yet mentioned, and that we do know that some international students will be delayed, and they may not make it here for the first day of the semester because of some visa-related delays or appointments. And these students might be permitted or may be permitted to participate remotely in some classes until they arrive. But please be in touch with your academic advisor, with ISSO, and so that they can review, and particularly in ISSO, can review the details of your specific visa situation and your school or your program about academic issues. Columbia schools will not be offering every course in a remote format as we did during the pandemic, because as we've mentioned, we will be here in person and expect to resume classes in person. So if you will be delayed, you need to work with your school and advisor to ensure you have a plan in place for your specific program. Many programs are working to ensure that international students can enroll remotely as they experience these delays if they can't be here for the very first day of class. But not every program will have that availability, and you really need to contact your specific program and your advisor. So I'm going to end there just to say, again, I think if you heard from everybody, we're incredibly excited to welcome people back to in-person class and in-person activities. And a lot of work by the powerful group of women you just heard from has been done to ensure that we get to that place. So I'm going to turn things, I'm going to try and go through a couple of the questions that I've seen come in repeatedly, even though some of them have been answered. And we'll try and get through as many of these as we can in the remaining time that we've had. One question, I think there's been a fair amount of questions about mixing vaccine. And so Wafaa, perhaps I can turn to you and you can speak to the fact and others about the fact that some people will get one dose of one vaccine. They may not have time to have the second dose, and or they have completed their vaccines, but it's not a WHO or FDA approved vaccine.
Thank you very much, Julie. And I think what certainly we, the university, will only accept an FDA or WHO authorized vaccines. So keep that in mind. If you have received another vaccine that's not on the WHO authorized list, then you will need to be revaccinated when you come to New York City, when you come here to Columbia. So just keep that in mind. We also know that there may be, people may have received one dose and not more than that. So I think the CDC has given guidance in terms of the need to then revaccinate individuals who've received one dose and not more, if that's one of those authorized vaccines from the WHO. So please share with us this information, but do it for those who received other vaccines not on the list. They will need to be revaccinated when they arrive. And please, as Melanie said, please keep that in mind, that if at all possible, do try to arrive early so that you can get the benefit of being vaccinated as soon as you arrive, or at least starting the vaccination schedule as soon as you arrive.
And Donna, I know you've mentioned this on other calls, but if somebody has received one vaccine of the FDA or WHO approved, they will be able to receive the second dose here when they arrive.
Absolutely. That was an early restriction that the governor had in place, that you had to get 2 doses in the same place. We now will give second doses. And I think Melanie would agree that, as soon as you arrive, the vaccine locations are open, and we don't have problems with waiting, and we'll get you in as soon as we can. And I know a number of people were worried that they wouldn't be able to go to class. They'll be able to go to class. You just will be wearing your face covering until 2 weeks after you are fully vaccinated, even if that is 3 vaccines.
And Melanie, maybe you can speak. I think there, as you mentioned, Donna, there have been a lot of questions about, can I register for class? Can I access campus, even though I'll be arriving not fully vaccinated or need to have my vaccine when I get to New York City? Could you comment a little bit?
Yeah.
We do want to welcome you to campus.
Absolutely. We understand that vaccine access is not the same all over the world, and we won't restrict you. So you will be able to move in, you will be able to access campus, but you will have the additional safety restrictions in place because you are not considered fully vaccinated. Right now, There is not a required quarantine in New York State. That may change, so just keep watching that, obviously, depending on where you're coming from. And similarly, we haven't enforced a quarantine for those arriving from campus from certain locations, but depending on what's happening with rates, that could change. So we will notify you, but the expectation is you could still move in even if there was a quarantine requirement. We will make testing available to all of our students, including our international students arriving, so you can use our testing resources, and then masking and distancing while you're getting fully vaccinated. And as Donna said, we can ramp up our capacity at our vaccine sites. There's ample vaccine availability throughout New York City. So as soon as you arrive, you should be able to start your vaccine series. And the only restriction, as Wafaa mentioned, if you've had some vaccine elsewhere that is not acceptable, the only recommendation we have is that it's a 28-day window between receiving that vaccine and then starting a new series in the United States. So think about that timing as well, depending on when you're receiving a vaccine. If it's within that 28-day window and it's not a WHO authorized vaccine, then maybe you want to wait.
And Julie, just two things I'm noticing. People are asking, should they come to New York early? And is Columbia providing housing? And the answer is no. We're not providing housing. There's no need to come early to get vaccinated. As we said, if you arrive because of other issues, you arrive on August 28th, I'll just pick a date, we'll get you vaccinated. And again, the face covering will just continue.
Thank you. Melanie, there's some questions I saw about the documentation not being in English and being able to upload documentation about vaccine in another language. Can you comment a little bit about that and what arrangements are being made?
Yeah, if your vaccine documentation is in another language, we ask for a certified translation along with that you upload with that, so we can then review it and check the compliance. So a certified translation.
Okay, great. And I think the other question I think is important, in addition, as I said, to be in touch with your program for academic advice or guidance. Please also be in touch and submit questions to Columbia Health. I think, Melanie, perhaps you can put that into the chat if you have questions about your specific situation and you need additional guidance, because I think we are certainly here to help provide guidance and let people know what they can and can't do. But you will be able, just to reiterate, you will be able to access campus. You will be able to arrive here, and again, keep checking in with our COVID-19 website also to see if any restrictions or guidelines are changing. But we want you to arrive, and we will work with you to get your appointments and to make sure that you are safe on campus. So I think there's also a couple questions about quarantining if you're not vaccinated and you're in a dorm situation and not in a single. And I know, Melanie, you've been working closely with facilities, and maybe you can comment on that as well.
Yeah, we're still reviewing the doubles in the dorms in terms of what we will do around that. As we're saying right now, there is not a quarantine requirement for New York State, and we have testing, but obviously if that changes, we'll make sure arrangements are made regarding quarantine.
Okay, great. There's some question about when you arrive and when you have to have gateway testing. And perhaps you can comment a little bit on that. So some people may arrive not to campus, but in New York earlier, and when should they have their gateway testing done? And my assumption is that they should do it as soon as they can when they arrive.
Yeah, absolutely. It's going to be pretty open all through August. So if you're arriving, get it done before your first day on campus. That's great. If not, you can get it done when you're on campus. We're going to have a gateway window those first couple of weeks that classes are back. But again, the earlier the better. It'll just allow you to check off one compliance item.
Great. There's a couple of questions, Wafaa, maybe I'll turn this to you, about flu vaccine and requirements related to the COVID vaccine and the flu vaccine. And if I want to make sure we don't confuse the two, and that people understand that we are requiring the COVID vaccine. And if you have a flu vaccine in your home country, that would not fulfill the requirements. And maybe you can talk a little bit about that.
Yes, absolutely. I think we're focusing on the requirement for the COVID-19 vaccination and vaccination documentation. It's not required to have the flu vaccine for registration. and Melanie can correct me if I'm wrong, but nonetheless, of course, in the fall, in the Northern Hemisphere fall, then early fall, then flu vaccination is required for all of our students. So just keep that in mind. But the most important thing now is to focus on getting the documentation for COVID-19 vaccination, either where you are or to complete the vaccination here on arrival.
Yeah, and just to reiterate, we've heard almost nothing about the flu vaccine. They need to start detecting flu strains before they decide on the vaccine. So I think we suspect that administration of the flu vaccine might start in October, but we've had no advance notice. It's nothing for anybody to worry about, and we'll be providing it free on campus as we have in the past.
Melanie, I think you mentioned this, but I just want to, I've seen a few questions about not being able to access the app internationally. So can you just mention again how people can upload documentation if they can't access the app?
Yeah, and again, for students, the app does not need to be your primary way of uploading documentation, so don't worry about it. It's through the Columbia Health or the CUIMC Student Health on Haven portal, depending on which campus you're a student at. So if you're a Morningside student, it's https with the / secure.health.columbia.edu. Just go to Columbia Health website or go to CUIMC Student Health on Haven website, and you'll be able to link directly from there. So don't worry about the app in terms of uploading any of your documentation. The other thing as well, because it is a separate portal, that checkbox on the app, if you do have the app, does not get checked immediately for students. That we have to do a back-end feed to IT. It's not happening yet. It will happen before August 2nd. So don't worry if you've uploaded your documentation to the health portal, but your app is still not checked. Don't worry. If you want, firstly, it takes us about 10 days to process. That's why we ask for all this to be done in advance. But just go back into your health portal and you can check your compliance status there. And obviously we'll communicate with you if we need additional documentation. So the checkbox in the app will happen before August 2nd.
And just a reminder, someone did ask, should they, even if they've had a non-approved WHO vaccine, should they upload that information? Absolutely not. Don't worry about uploading that. Wait until you get to Columbia, and then your 1-dose or your 2-dose regimen at Columbia, you can upload once you're here. There's no, as much as we want as many people to upload by August 2nd as we can, if you're getting a vaccine that's not approved, just wait.
Yes, I agree with Donna. If you're getting a 1 dose of a vaccine that's authorized, please upload that. We will note that it's just 1 dose. Yeah. Thank you.
There's a couple questions about isolation. If somebody's been exposed, either during travel or when they get here, and whether or not maybe they've had contact with someone. And can you speak a little bit about the process? And then I'll answer just before you get to that, Melanie. Just what about their being access to their courses if that course is not available online? And so, I think I'll let Melanie speak to the process. And you're certainly, if you have to quarantine because you've been exposed, you can certainly work with your academic program. If that course is not being offered remotely, then we'll work with you in another way. But Melanie, can you talk a little bit just about that?
Yeah, sure, Julie. So we have supported isolation and quarantine of students throughout this pandemic, and we will continue to do so. Isolation, which is when someone is tests positive, is done separately, and we've had isolation facilities both for undergraduate and graduate students in order to support them if they couldn't isolate safely in their current environment. We'll continue to do that. Similarly, for quarantine, often we are able to quarantine our students in place where they are and do so safely, and we'll provide guidance in terms of how to do that. And when there are extreme circumstances where it's not safe to stay in that place for quarantine, we do have some support around that. That is for everything outside of travel quarantines. Obviously, that is managed a little different, but from a close contact exposure or a positive case, we have been and will continue to support students throughout the fall with that.
Great. I think most of these questions have been answered, but I think we are still seeing a bunch of questions about whether or not people can access campus and move into housing, and said the answer is yes, you can. We will work with you to get your vaccination appointments as soon as possible. And I think, as Melanie just mentioned, you know, depending on your living situation, we expect you to be able to access campus. You'll be required to mask until you pass that magic 2-week window, but you will be able to access campus. And if there's a particular situation, living situation, we're working on that in terms of the doubles, as Melanie mentioned. So more information on those things to come. But please know that you will be able to come here, begin your registration process if you're not already registered or ready for class, and that you will be able to move in. Let's see if there are other questions. I think we've gotten through most of them. I think there are questions, and I know we have some folks from ISSO here. If you have, can I be vaccinated if I travel to New York with my travel visa, even if you haven't yet been issued your F1 visa? I wonder, Maria or Samantha, if you could help us with answering one of those questions.
Certainly. In terms of international student coming to the US, if you, someone did ask whether they can come on the tourist visa. So of course you can come on the tourist visa to get vaccinated. However, just be mindful that you will have to exit the country and re-enter on your F1 visa at the later stage before you begin your studies in the fall. So that will be possible if you can arrange housing to come to campus and get vaccine and stay. You will not be able to stay if you come on the tourist visa to continue in the fall without leaving. That will be a key.
Okay, thank you. And they would have to return then to get their to fulfill their appointment for their F1 visa, et cetera, as per normal.
Yes, correct. Thank you.
Great. Yes, thank you. Okay, I think we have gotten through most questions. I don't know if Donna or others, if you see other questions that I haven't yet gotten to. But I think we have gotten through most questions. And we're just about out of time. So I think we've managed to do that pretty successfully. Safwan, I don't know if you want to add a couple of closing comments. A lot of questions and answers flying around here, and a lot of information. I want to just say two things. One is we will continue to hold these throughout the summer. So please watch, because we know that information is changing and access to vaccines and approvals are changing in New York State, et cetera. Guidelines are changing. So we will continue to hold these so we can answer questions throughout the summer. We'll also include more information about accessing campus and campus facilities as we go forward. And we plan to have these both in July and August. So stay tuned for more information, and thank you all for your interest and questions and keeping us busy throughout this half an hour time slot. Safwan.
Thank you, Julie. I mean, my first thanks is really to the students for asking those incredibly important questions, for wanting to get the information, and for challenging us also to always expand and try to find solutions that we may not have thought of, but we're constantly thinking about all of these things, and we're incredibly looking forward to having everybody come back to campus. This session has been recorded and will be accessible on the Global Center's website, and will also be shared with all of those who registered for the webinar, so that you can go back and recheck something if you're not sure that you fully understood or captured the answer. Huge thanks to you, Julie, for your leadership and for moderating this, and Wafaa, Melanie, and Donna. The university community is forever grateful for everything that you do to ensure our safety and health, and the students really should know what a particularly important role the three of you continue to play, and will continue to as we come back to campus. Thank you, Samantha, for contributing your input. We also should let the students know that we have ISSO, International Students and Scholars Office, programs and webinars running throughout the summer. We'll continue to do everything that we can to address your questions and to ensure a smooth transition back to campus. And we all look forward to seeing you. So thanks everyone very, very much for this. Bye.
Thank you.
Bye, everyone.
Bye.
Bye.
Thank you.